N has a major medical policy that only pays a portion of N's medical expenses. N is responsible for paying the remaining balance. This provision is known as assignment of benefits, coinsurance, indemnity, co-deductible. The correct answer is coinsurance. Coinsurance helps contain the insurer's cost and reduce unnecessary medical claims by forcing the insured to share the cost of a medical expense. Normally, the insurance company is responsible for a larger amount, like 80%, leaving the insured responsible for 20%. Which of the following statements best describes the intent of a coinsurance clause in a major medical policy? Discourages overutilization of the insurance coverage, minimizes the need for deductibles, discourages adverse selection, minimizes the waiting period. The correct answer is discourages overutilization of the insurance coverage. The coinsurance clause in a major medical policy outlines how medical expense costs will be shared between the insured and the insurance company. Sharing the costs discourages the insured from using the coverage more than medically necessary. Major medical policies typically pay 100% of covered expenses, contain a deductible and coinsurance, require use of in-network facilities only, do not contain a deductible and coinsurance. The correct answer is contain a deductible and coinsurance. Major medical policies are typically provided through a managed care organization, meaning they utilize deductibles, coinsurances, benefit period limitations, and/or provider restrictions to help contain the insurer's cost for claims. Which of the following policy features allows an insured to defer current health charges to the following year's deductible instead of the current year's deductible? Deferral provision, carryover provision, stop-loss provision, corridor provision. The correct answer is carryover provision. The carryover provision allows an insured to apply deductibles paid at the end of one year towards the upcoming year's deductibles that need to be met. Since the insured carried over the prior year's costs, they are now closer to fulfilling any deductible required for this year, and closer to reaching the year's stop-loss. Deductibles are used in health policies to lower the incidence of fraud, the coinsurance amount, overuse of medical services, adverse selection. The correct answer is overuse of medical services. A deductible helps contain the insurer's cost and reduce unnecessary medical claims by forcing the insured to share the cost of a medical expense. Normally, deductibles are expressed as a flat dollar amount. The first portion of a covered major medical insurance expense that the insured is required to pay is called the corridor deductible, the initial deductible, the stop-loss deductible, the coinsurance deductible. The correct answer is the initial deductible. The initial deductible of a major medical insurance policy is a deductible that must be paid by the insured before any expenses are covered by the policy. This is why it's called the initial deductible. In major medical expense policies, what is the intent of a stop-loss provision? Limits an insurer's premium increases, limits an insurer's liability, limits an insured's out-of-pocket medical expenses, limits an insured's coverage for pre-existing conditions. The correct answer is limits an insured's out-of-pocket medical expenses. Stop-loss, or out-of-pocket maximum, limits the amount an insured will spend on medical care for a given year. It basically stops the insured's loss at a specific number. Once that number is hit, the insured is no longer responsible for any additional covered medical expenses. The insurance company will pay 100% for the remainder of the year. Q is hospitalized for 3 days and receives a bill for $10,100. Q has a major medical policy with a $100 deductible and 80/20 coinsurance. How much will Q be responsible for paying on this claim? $2,100, $2,020, $2,000, $100. The correct answer is $2,100. When trying to figure out what amount of a covered claim the insured will be responsible for, first, subtract any deductibles from the claim total as this is paid by the insured. Then, multiply the remaining balance of the claim by the insured's coinsurance percentage to get the insured's coinsurance amount. Lastly, add the deductible to the insured's coinsurance amount to get the insured's total responsibility for the claim. M has a major medical insurance policy with a $200 flat deductible and an 80% coinsurance clause. If M incurs a $2,200 claim for an eligible medical expense, how much will M receive in payment for this claim? $2,000, $1,760, $1,600, $400. The correct answer is $1,600. When trying to figure out what the insurance company will pay or the insured will receive in a covered health claim, first subtract any deductibles from the claim total as this is paid by the insured. Then multiply the remaining balance of the claim by the insurance company's coinsurance percentage.